This is Dr. Clive Persaud, double board certified cosmetic surgeon from Tampa, Florida, here with owner of SkinSpired Aesthetics, Jenny. So this is where I send all my patients for their post-operative care. This is the best care in Tampa, Florida. So we're going to talk about liposuction with a BBL versus a liposuction-based tummy tuck. So if we do liposuction 360, is generally where we harvest our fat for our BBLs. Our post-operative patients will not be able to sit on their behind for at least 2 weeks. So that does have a difference in their post-operative care. So I'll let Jenny explain exactly what goes into that.
Yes, it absolutely does. With lipo BBLs, a lot of times surgeons and post-op therapists try to recommend clients to avoid sitting for the first 2 weeks, and then at 3 weeks you can start doing incremental sitting. So you can start doing 10 minutes for the first hour and increase your way up on a weekly basis. The way that we will position you will have bolsters, wedges. The bed does recline up if needed for more comfortability. We want to avoid any kind of tissue pressure so that the fat actually holds and has enough oxygen supply. So
Perfect. So to contrast that with liposuction and a BBL, there's just small incisions that our cannulas go in to reduce the fat as well as perform the fat grafting. Now to contrast with a liposuction-based tummy tuck, there is a scar that essentially goes hip to hip in addition to the liposuction procedure. That does have a difference in our post-operative course and certainly in our post-operative care. So I'll let Jenny go into the difference.
yes, so the difference with that is definitely client positioning and then just being very cautious of how we handle the incision line, because we don't want to create additional tension for the integrity of the incision. So our care will be, we're usually 2 inches, maybe 3 fingers above the incision line when we start doing our post-operative treatments. The client positioning is definitely, you're at a incline so that we're not creating that tension by having you lay flat down. We definitely try to make sure that you're not using your abdominal muscles. If you've had a muscle repair, we want to ensure that you are assisted while reclining back. We monitor them just to make sure that there's no popping of the stitching, they're clean. We counsel them on how to do necessary cleaning habits, wound care if need be. Dr. Persaud and I are very, very communicative when it comes to our patients that we share. I love that about us. Like, you're Absolutely. Very communicative with me on it too.
So whenever you get operated on by me, you obviously get Jenny as part of the package for your post-operative care. And I personally want to thank Jenny and her staff here at SkinSpired Aesthetics. It's the best post-operative care in Tampa, Florida.
Thank you.
So thank you so much.
Thank you. I appreciate it. Thank you for trusting me.
Of course.
Bye, guys.